Good afternoon. I'm Michael Roberts, Dean of the Gupta College of Science at Coastal Carolina University. Could you introduce yourself for our viewers?
Hello, Dean Roberts. Thank you. I'm Fredanna McGough, and I'm the chair of the Department of Health Sciences here at Coastal Carolina University in the Gupta College of Science. I teach in the public health program.
Thank you. Could you provide a little background on the coronavirus?
The coronaviruses are a family of zoonotic viruses that cause illnesses that range from symptoms that you'll find in the common cold to severe respiratory diseases. These viruses lay dormant in animal hosts, but they have now made a leap to humans and infecting humans, causing the problems that we see today. We've seen other types of coronaviruses before COVID-19, for example, severe acute respiratory syndrome, which we know as SARS, and Middle East respiratory syndrome, which we know as MERS. COVID-19 is the disease caused by the novel coronavirus that was first identified in 2019 in Wuhan, China. We call it a novel coronavirus because it is a new type of virus that we have not seen before. So it is part of a family of viruses known as coronaviruses, but it is a new strain of virus that we have not seen.
Okay, thanks. And how does the virus spread?
The COVID-19 virus is actually spread between people who are in close contact with one another. The virus can be carried in droplets from coughing and sneezing, and it can land in mouths and noses of people who are nearby, and then or inhaled into the lungs. The droplets can also land on objects and surfaces that can be touched, and then people touch their eyes and their nose and their mouths, pretty much the mucous membranes.
What can we be doing to protect ourselves to help stop the spread of coronavirus?
The best way to avoid getting this virus, just like with a lot of other viruses that are respiratory in nature, is to frequently wash your hands. And you'll be washing your hands for about 20 seconds. So singing the ABC song or singing Twinkle Twinkle Little Star will give you an idea of how long you're supposed to wash your hands for. Avoid touching your eyes, nose, and mouth with unwashed hands, and just in general, avoid touching your eyes and nose and mouth because the virus can easily enter these mucous membranes. Cover your cough and your sneezes with a tissue, then throw the tissue in the trash, preferably a lined trash can. Make sure that you clean and disinfect frequently touched objects and surfaces because we know that the virus can actually land on these surfaces and could probably live there for up to 3 hours. So you want to make sure that you clean and you disinfect the spaces around you. To limit your exposure to the virus, it's really important to physically distance yourself from others, and this is known as social distancing. Don't go into crowds. Make sure that if you are interacting or engaging with people, that you are 6 feet apart, making sure that you only go places where there are people, again, distance from another person if you absolutely have to. But you've got to try to limit your exposure to this virus. If you have been exposed, please self-quarantine for 14 days. If you've been in contact with somebody who has tested positive for the virus, please self-quarantine for 14 days. If you do become sick, please make sure that you stay at home so that you are not risking passing the virus on to other people.
So let's say you contact the virus. What are some typical symptoms that you might see?
Some of the symptoms that you may experience if you have COVID-19 is fever, specifically 103 degrees Fahrenheit or higher in some cases, a dry cough that's persistent, and tiredness. In some individuals, you may get shortness of breath and difficulty breathing. If you are having difficulty breathing, you may want to seek a healthcare professional. If you do have COVID-19 and you are living with someone. If you have a roommate, or if you, of course, you're with family members, then it may be difficult trying to determine how to do self quarantine. Okay. Main thing though is if you are sick with COVID-19 like symptoms, or if you actually do have COVID-19, it would be a good idea to actually stay at home and practice social distancing. Even if you're living in the same home, try to have like a designated sick room that you're able to stay away from others as much as possible. Try to limit the use of shared spaces, and if you do use shared spaces, be sure that you're wiping down like high touch surface areas like countertops, cabinet knobs, doorknobs, doors, the toilet flusher, dishwasher handles, and and oven handles. Try to make sure that you're wiping those down daily. It may even be a good idea to have a separate bathroom for somebody who actually has the virus. Cover your coughs and sneezes with a tissue and throw them away in a lined bin, making sure that you're continuously washing your hands with soap and water for at least 20 seconds. If you are unable to wash your hands with soap and water, please be sure that you use alcohol-based sanitizers that have at least 60% of alcohol. Making sure that you're keeping hydrated, and try to make sure that you eat so that you can keep up your energy, you can keep up your resistance. Have someone drop off food at your doorstep because you will not be able to go shopping. So these are all practices that would be beneficial to you. If you suspect that you have the virus, you can contact the MUSC Health Virtual Urgent Care, and they will provide a screening virtually so that you'll be able to talk to somebody about what may be happening to you. Even though it is virtual, you do actually get to speak with a virtual care provider, and to be able to access the system, you'll have to have a profile. So you'll need to create a profile. If you are not in South Carolina, make sure that you take a look at what your state is actually doing. If you do have a medical emergency, for example, you are having trouble breathing and you have persistent pain or pressure in the chest and are unable to get up, or you lose color in your face and your lips, for example, you start going blue or dark purple, then you may want to consider calling 911 as a medical emergency.
As a public health educator, what are the types of public health responses that we see in response to an epidemic like this?
First and foremost, keeping track of those who are getting ill. So there is a surveillance system in place, surveillance measures are being taken, and descriptive studies are being done to track the distribution and the spread. So collecting how many people are getting sick to determine the extent of the burden on a community is really important. And the reason for that is so that these communities can get the necessary equipment, the necessary support, and those who can actually provide help to these individuals will be able to determine how many people are going to be able to do that. Determining how many people are dying, unfortunately, is something that we also do within the public health field. So trying to determine a case fatality rate so that we can determine how to reduce that, how we're going to be able to address some of these conditions and these problems so that we can reduce the case fatality rate. Determining also how many people are recovering, and I think that this is a wonderful thing, because we recognize that 80% of individuals who actually get sick will recover. And so we want to really, let people know that this is something that you can recover from. The issue that we do see is that those who get seriously ill, we have to figure out how to minimize our exposure to individuals who are more susceptible to being sick, or to being seriously ill when they do get sick. So those with underlying medical problems such as high blood pressure, heart disease, or diabetes are individuals that we try to minimize exposure. The ways in which we try to minimize this exposure is through public health response. So, for example, doing health education. So, hand washing campaigns is really important, making sure that people are coughing and sneezing into tissues or coughing and sneezing into the elbow of their arm, making sure that we are educating people about the ways in which to prevent the contraction of the virus and also minimizing the spread.
Are there any other things we should be doing in response to this virus?
Yes, your emotional health is very important right now. If you're living by yourself or you know of others who are, try to keep connected with family and friends virtually. Social distancing does not mean social isolation. If you're in a crowded space because everybody's gone back home and the children are at home from school because of the quarantine, please try to find moments where you can have some me time. Please go somewhere where you can quietly just close the door and just get away for a few minutes so that you can collect your thoughts. If you find that you have time on your hands, consider looking into a new hobby. You may find a skill that you never thought you had before. Some individuals are making face masks. Try to be part of the solution. Follow public health practices by social distancing, hand washing, practicing hygiene and sanitation, and limiting touching of your face. Other ways to be part of the solution is to fight social stigma against groups of people. I recognize that we're all scared and that we're anxious about what these issues mean, but please recognize that we are part of a global village and we should be collectively trying to address the issue. Let's listen to facts-based information and try to do everything we can to reduce fear-mongering. If you're looking for additional information about COVID-19, please visit the Centers for Disease Control and Prevention, which is at www.cdc.gov, or the South Carolina Department of Health and Environmental Control, DHEC, which is at scdhec.gov, or look at this warehouse of information for South Carolina at the Alliance for a Healthier South Carolina at healthiersc.org. You'll find a lot of updated information and a lot of resources for your benefit. Thank you for the opportunity to share with you today.
Thank you very much for being with us today, Dr. McGough. I really appreciate it.